Hey, this is Dr. Ben Mackey, and I'm the eye surgeon at Mackey Vision Center. I wanted to make a video that basically gives you the standard preoperative cataract counseling that I give all my patients. Because so many times I have patients that will come in the office and they're by themselves and they don't remember everything, or they get distracted and they want to go home and ask questions or just listen to what I said with a family member. And so this is a way that you can listen to my cataract pre-op counseling and pause it, rewind it, dissect it, analyze it, criticize it, do whatever you want with it. So here it is. So here's the deal. The first thing I do when I'm with a patient who has a cataract is I always look at the chart to see what their best corrected visual acuity is. And one of the reasons I do that is very practical, and that is that most insurance companies set criteria by which they will reimburse or pay for cataract surgery. So that makes a lot of sense. You don't do cataract surgery, and insurance companies won't pay for cataract surgery if your vision is 20/20 perfect. And we wouldn't want to do that. If your vision was perfect, there would be no reason to do surgery. So that makes sense. So they set criteria. The vision has to be below a certain level to do surgery. So I look at those numbers and make sure that a patient qualifies for cataract surgery based on their visual acuity. The second thing that I do is I want to look at the cataract, and that's just as important, probably more important, because I want everything to make sense. There's a lot of things that can affect your vision, and I want to make sure the cataract matches the visual acuity. I've been doing this for years, thousands and thousands of eyes. I should be able to look at a cataract and tell you what your vision is based on looking at your cataract if everything else in the eye is normal. Grading a cataract, looking at a cataract, is kind of like grading swamp water, clear to muddy. You've got clear water, you've got totally muddy water you can't see through, and there are varying degrees in between that. And so when I look at a cataract, I grade it on a scale from about 0 to 6 in general, and I put a number on that. And I've gotten good over the years at looking at that scale or the opacity of that cataract and saying, hey, this person's going to be really happy if I take this out, or maybe this patient needs to wait a little longer. I don't think they're going to really see the difference or the big benefit from doing cataract surgery. So that's my job, and and I pride myself on that. And also, you just want it to make sense with the vision. So if the cataract looks bad enough and it matches the visual acuity, and the visual acuity is bad enough, then I will make a judgment and I'll recommend cataract surgery, and the patient and I will decide to do cataract surgery. In my office on the same day as our pre-op counseling, we will go ahead and schedule the surgery. I operate on Mondays at the Cumberland Valley Surgical Center, which is at exit 29 in Corbin. It's kind of across the road from the Cracker Barrel, easy to find. We'll give you a map. We'll set a date and a time. You have to show up at the surgery center on the Monday with a driver because you will be a little bit sedated. And you and your driver can count on being there for maybe 1 to 2 hours. Just depends on how things are rolling and how things are going. But count on 2 hours being there total time. The nurse will call you back. They'll lay you down on an operating room bed, and they'll put some drops and things in the eye to numb the eye, to kill bacteria, to dilate the pupil. And then they'll put an IV in your arm. And then when the time comes for the surgery, they'll wheel you back to the operating room. I'll come in. I'll be dressed all in blue mask, blue hat. You won't recognize me. You might hear my voice and recognize me, but otherwise no. And I'll say hello, and then you will get some medication through your IV. Usually we give Versed and sometimes a little propofol or fentanyl. And that just takes the edge off. I really do not want my patients totally out during cataract surgery. I want you there with me, able to respond to me, but just relaxed enough basically to where you don't care about the surgery, which is nice. The surgery usually takes less than 10 minutes to do, and after we're done, you'll have a clear plastic shield that the nurse will tape over your eye to protect it. It's very typical after you go home that day to have a little scratchy feeling, foreign body sensation in the eye. That's very, very normal. The next day, you see me in the office. We take the shield off. We check the vision, check the implant, check the pressure in the eye, and then you go home and start your eye drops. The eye drops are really the worst part of the surgery. Almost every patient tells me that. And I will mention this, there are ways that have been developed to eliminate the use of eye drops after cataract surgery. Wow, that sounds really, really great, and I would love to do that. However, I've looked into all the studies and I've taken some courses and I've looked into it. And in my opinion, the safest thing to do after cataract surgery is still to put drops in your eyes for about 3 weeks. And so that's what I have my patients do. You'll have instructions on how to do that, and it's not the funnest thing in the world, but it's the safest thing to do, and it's only for a short period of time. The recovery from cataract surgery is really almost always very, very quick. Most patients are seeing better the following day after the surgery. It gets a little better from there, and then it plateaus and stays really, really good. I have almost stopped giving any restrictions after cataract surgery. I do ask people the day of the surgery to relax, take it easy, don't do anything strenuous, don't lift anything heavy, don't bend over, take it easy at home. But literally, I've had patients on the golf course the next day. The day after the surgery, you can pretty much get back to normal. I probably wouldn't want you lifting like a couch or something, but you probably shouldn't be doing that anyway. So for the most part, you can get back to normal. It's not like it was even 20, 30 years ago. It's different than it was. The incisions are just smaller and it's a safer procedure, and the recovery is a lot faster. So usually if everything goes well, we'll do the other eye within a couple of weeks, but of course that's up to the patient. And then I want to discuss two other very, very important things. So the first is that this is real surgery, and I know you know that, but it's good to say that out loud. This is, I take this seriously. It's not tiddlywinks. There are risks of bleeding and infection. There's risks of vision loss and blindness. Those risks are infinitesimally small. And so it's a very, very safe procedure, even compared to all other surgeries and procedures. But it is real surgery. And if you want to see me doing commentary on an actual routine cataract surgery, I'm going to make another video. I know some of you are squeamish, so I'm not going to do that right now. But if you want to watch that video, feel free to do that. The other thing I want to discuss is the implant that goes along with cataract surgery. At the end of the surgery, after we take the cataract out, there's an implant that will be in your eye the rest of your life. It's made of acrylic or sometimes silicone. And these implants, they come in different flavors, if you will. This was not the case years and years ago, but now there are implants that can correct astigmatism, which is the change or the difference in the curvature of your eye. And also there are implants that can focus at different points so you don't have to wear reading glasses. Standard implants, when I say standard, what I mean is that your insurance company will pay for that. Do not do those two things. Don't correct astigmatism and don't focus at 2 points, distance and near, at the same time. So these other implants are an additional cost to the cataract surgery. Mackey Vision Center, our office now, is charging, and this changes periodically, but we're charging the total cost of an astigmatism correcting lens is about $1,100 per eye, and part of that goes to the surgery center, part of that goes to the office, Mackey Vision Center, and then a presbyopia correcting or multifocal implant is $1,700 per eye. And again, that's split into two payments, surgery center and physician office. So I wanted you to know about that. And that is pretty much it. This is you never have to have cataract surgery. There are times when I'll tell patients that, listen, you need to get this done because if you wait too long, it can become more difficult to remove. But you can always, it's never an emergency. One of the reasons I like my job. And so it's a decision that really you make, but I help you make after looking at your cataract. I hope that gives you a lot of information, and I hope that you find this video very, very helpful. I'm going to make another one, and it's going to go into details about the actual steps of the surgery, so you can watch each little step if you want to. It's been a pleasure. Remember, the rest of your day is a blank canvas, and you can make it your masterpiece. See ya.